Since its move from Oklahoma City to Stillwater, the state's public health lab has seen its fair share of troubles, including a surprise inspection by federal regulators. Steve Shaw spoke with Paul Monies with our content partner, Oklahoma Watch, about the lab's issues.
Paul, tell us what kind of issues have developed since the public health lab moved to Stillwater earlier this year.
That's right, yeah. The state officials had a big announcement last October in 2020 and said they were going to move the public health lab, which was based at that time in Oklahoma City. Part of the reason for that was because the old lab was kind of moving, it had some motor equipment, and they needed to move to new headquarters for the offices, but that didn't accommodate the lab. So they said they would push it to Stillwater and then combine it with the new pandemic research center for kind of the next pandemic, so to say, after COVID-19. And it's been a little bit of a rocky transition, to say the least. We talked to several former employees who were at the lab before and after the move, and they noted a lot of stuff going on with, even when they got there, lack of electrical outlets to get the office building ready. The high-speed internet wasn't as up to speed where they were expecting, and they finally fixed that. But along the way, they've had a lot of transitions with the workforce, who a lot of the people didn't want to make that transition to Stillwater.
What is the state doing to make changes as suggested by the Centers for Medicare and Medicaid Services after that agency's surprise inspection in September?
That's right. The federal agency that kind of inspects public health labs and private health labs was kind of had an anonymous tip to kind of look at some problems in the public health lab after it moved to Stillwater. The feds came in, spent a couple of days on site, surprise inspection in September. Found quite a few things to go through. It was actually an almost 40-page report that they finally put out to the state and said we found all these things wrong, including, delays in COVID-19 testing, incorrect temperature of storage of samples, incorrect kind of processes for their couriers that come and bring samples to the lab, and other kind of simple stuff as not keeping up with the training for their employees who had since joined the public health lab.
During the move, the lab had to outsource some of the testing. How'd that work out?
That's right, yeah. I mean, they did expect some testing to be outsourced because, when you move equipment or have brand new testing equipment, you have to kind of calibrate it. So they did expect some of that to be outsourced. They spent some money on that and budgeted some money for that. But they also said, too, they found some problems with their existing processes for newborn screening. And they said that was a big problem on a red flag. They vowed to do an internal investigation. Our reporting said that really didn't amount to much and was more of an attempt to kind of throw the older employees under the bus who used to work there. They spent a lot of money outsourcing that newborn testing and then brought it back in the summer with just one extra test. So it wasn't as much as expected in terms of the increased testing that they're going to do, and it kind of caused some problems with some of the employees too.
Two more questions. What kinds of tests are being impacted by the changes to the public health lab?
Yeah, we talked to former employees as well as folks who are kind of in the testing side outside of the health department, and we talked to some folks who are active in sexual health education. They said since the move to Stillwater, they've seen delays in tests for chlamydia and syphilis and that kind of thing, which obviously that's a very time-sensitive thing you need to do in turnaround times. We asked the health department for the turnaround times before and after the move. They did not provide that to us after we gave them some time to do that, but they did say that they're trying to turn them around within 7 to 10 days. Of course, the federal report came in and said they were not tracking any turnaround times, so there was a little bit of mismatch in the statements there. They're finally kind of moving back to a lot of that in-house again, but they did have a period of time, 6-7 months this year, when they were outsourcing a lot of it.
And finally, is there a cost to this move to privatize the health lab?
Yes, when they announced the move first time last year, they also said that they were going to privatize some functions to this new group out of Stillwater that kind of is under the Oklahoma State University Research Foundation. It was a brand new group called Prairie One, and they said this will be the management of the lab and the pandemic center. They will save money here, they will make money here. So far, they've paid that group about $1.7 million for their management fee. They said they would have what's called a biorepository up and running to make some money and kind of offer other services to outside labs. That's not going on right now, so not bringing in any revenue. So it seems like it's been a little bit of a cost in the transition, and our health department officials have vowed that that will come at some point, and there were some supply chain issues in getting that biorepository up and running. But at the end of the day, there's been a lot of turmoil in the public health lab and a lot of employees that have left that institution since last year.
We'll keep our eye on it. Paul Monies, thank you very much.
Thanks, Steve.